All right, this is video submission of our skills checkoff list. This is my wife, Katie, helping out. Thank you, Katie. Okay. Ready? I love you.
Hello.
How are you doing today?
Doing all right.
My name is Chris. I'm going to be your nurse this evening. Can you confirm your name and date of birth for me?
Catherine Abigail Smith, 10/19/1990.
All right, great. Well, we're going to be doing your physical assessment today. It's going to take about 30 minutes. Is that okay?
All right.
Do you have any allergies we should be made aware of?
None that I'm aware of.
Okay, good deal. We're going to provide for privacy, gather our supplies, do our hand hygiene, and put on gloves. I happen to have a set of gloves. Right. We're going to come, just raise the bed to a proper working height, lower the handrail for our assessment. Okay, let's see here. We're going to start with checking the hair to see if there's any abnormalities with hair growth, bald spots that shouldn't be there, any redness, dryness, itching, sore scalps, lesions. Anything that shouldn't be there, lice, other critters. She looks good. While I'm doing this, I'm assessing that she is wearing proper clothes for the season. So there's no hygiene issues that I can notice. Can you tell me where you are today?
I am at my house.
Okay, and what day is it?
It is Thursday.
Okay, and what are we doing?
We are doing a clinical skills check for you.
Okay, so she is alert and oriented to 4. So that's good. Okay. While we're doing this, we're going to check her face for symmetry, abnormalities, the overall shape, any droopage to the eyelids or lips. Can you go ahead and smile for me, frown, and puff out your lips? Okay, so your nerve is in good condition. Okay. Let me think for a second before I move on. I see that you're wearing glasses, so we got that noted. And yeah, while we're here, go ahead and turn your head to the left all the way. Turn your head to the right all the way. All right. Now look straight ahead. Turn your head towards my hand, forcefully if you can. All right, good deal. Now the other way. All right. Okay. Sorry.
It's all right.
Okay. Your head looks to be in good shape. We're going to go ahead and check your eyes, okay?
All right. Do I need to remove my glasses?
Nope, you can leave them on as long as we don't have any glare.
Okay.
We should be good. Okay. Look straight ahead. All right. Our pupils are reactive to light. They're equal size, roughly 3 by 3 millimeters. And her corneas are clear. Her sclera is white. Her conjunctiva is pink, moisturized, and intact. Okay. Slowly talking my way through this, sorry.
That's good.
Okay, we're gonna go ahead. We're not done with the eyes. I almost forgot. Okay. Look straight ahead and focus on my pin light here. When I move the light, look forward at the wall right in front of you. All right, everything looks normal. Now follow the pin with your eyes only. All right, we're gonna come in, follow it as best you can. All right. Her ocular nerves seem to be intact. And before we move on, would you mind looking up for me? With your head, tilt your whole head up. Thank you. I'm going to check her septum, see if there's any deviation. Hers looks very straight. You check the patency of the nares. Close one nostril and breathe in for me. Now the other one. They both seem clear and good. Looking at the mucosa of her nostrils, it seems to be intact, the right color. moisture and no bleeding or any kind of fluid leakage. It looks good. Okay, now we're gonna move on to the mouth. So if you don't mind, open and say ah with your tongue out.
Ah.
Okay, the uvular lines is normal, looks good. Her tongue is good and pink, symmetrical, no abnormalities in the shape or size. Show me your gums. They are pink, healthy, no bleeding, no abnormalities. I see you don't have any fake teeth that I could tell. Is that right?
Not that I can tell. No.
All right. So it looks normal. One more time when we look at your, open up, say ah.
Ah.
Okay. I don't see any swelling or indications of swelling with your tonsils. You have tonsils?
I do not have tonsils.
Okay, that's why we don't see them. All right.
No tonsils.
Good deal. Okay. So everything looks normal. No swelling of the throat, no abnormalities, color, anything like that. Have you had any difficulty swallowing?
No.
Okay, good. So, let's check your ears before we move on from the head.
Okay.
It's just easier to go in order of top to bottom. Okay, I'm going to be looking in your ears. I'm going to pull up and back.
Alright.
I notice there's no hearing aids. Have you had any trouble or pain in your ears, hard of hearing, anything like that?
No.
Okay, ear canal is cleared. Everything is normal with her earwax, no abnormal colors or amount. Same on this side, no redness, no irritation, no itching you experienced?
No.
Okay, good deal. Right, I'm gonna check your ears for tenderness. I'm gonna check the pinna. Is that tender?
No.
And the triangle part, I don't know what it's called. Any sensitivity to that?
No.
No. Okay. On this side, same thing. Tell me if it hurts now.
No.
Okay. Nope.
No.
All right. Good deal. Okay. Let me just go through in my head that we've hit all the cranial nerves and everything we need to do with the head before we move on. I don't notice any breath odor, which is something I needed to put out. None that
That's
I'm
nice.
I'm just kidding. I'm just kidding. Anyway, let's see. No, normal. Okay, we're gonna move on. Let's see.
Alright.
Now we're going to move on to the throat and assess her. You know what I need to do? We need to do the lymph nodes before we go on. So we check all your lymph nodes. It's normal not to feel them. So nothing I can feel any tenderness for you?
No.
Okay. Oh, sorry, I forgot your tooth. No tenderness?
No.
Okay. One more cranial area we have to check that I forgot. Now that I'm thinking about it.
Okay.
Shrug your shoulders against my hands. Okay, looks good. And I don't see any abnormalities in her lymph nodes. They seem to be normal, not swollen, non-noticeable. Okay, tilt your head up and look at the ceiling. I'm going to assess your trachea to make sure that it's straight and symmetrical, no swelling, no abnormal lumps, lesions, discoloration. It looks normal to me. Now, with your head tilted up, go ahead and swallow for me. Okay, swallow again. Any pain with that?
No.
Okay, good deal. So, trying to remember what that's called. 1 second. It's the gland in your throat that looks like a butterfly. I'll come back to it when I think of it. But that's what
Okay.
we are assessing. It's normal, not swollen. Okay.
No.
Yeah, that's same thing. Same thing. I love you.
I love you too.
All right.
I was wrong, for the record.
Yep. Okay. Pharyngeal gland? I can't remember. No, it's not the pharynx. That's inside your throat. Okay. So now we're going to look for distension in her carotid arteries here. I don't see any. I adjust the bed to a 45-degree angle as best we can. But so look that way for me. Nothing. Look the other way for me. Nothing. Now I'm going to go ahead and palpate them with my fingers. Normal. Normal. And while we're here, we're going to go ahead and listen to her carotid artery with the bell of the stethoscope. Hold your breath for me. Okay. Everything sounds normal. I'm going to think of the gland in a minute. It's bothering me. Okay.
I like that it bothers you.
All right. We got your jugular or your carotid taken care of. We assessed your esophagus. It is straight, normal, no discoloration. Now we're going to listen to your lung sounds. So go ahead and lean back for me. Anytime you feel my stethoscope touch your skin, just take a deep breath for me, okay?
Okay.
And we're noting this is on bare skin. Okay?
Mm-hmm.
That is 10 times in the front. While we're assessing this, before I have her lean up, we're going to go ahead and listen to the valves of her heart. Get that taken care of with switch to less motion. Okay. First, we're going to listen to the aortic. To the pulmonary valve. The tricuspid. I'm sorry, the Erz's point. Tricuspid. And then the mitral valve, where we'll assess for 1 minute to get the apical pulse. Okay. All right, everything's normal. Okay. So that's everything on the front. For now, have you had any chest pain?
No.
Trouble breathing, shortness of breath?
No.
Okay, have you had any kind of surgery or injury that would affect your ability to breathe?
No.
Okay. Now we're going to lean forward so that I can listen to the back of your lungs here. Go ahead and breathe. listen to her lungs in the back. They sound normal and good. I realized partway through that I was doing the Z formation instead of the step down ladder, which is appropriate. So we caught that. Okay. Lift your arm for me. We're going to get the side of your lungs real quick. Breathe deep. Okay. Other side. Deep. While I got you sitting forward, I'm going to go ahead and palpate the back while you breathe deep so I can check for symmetry of the lungs. Go ahead and breathe. One more time. Have equal expansion, very symmetrical. Any tenderness back here?
No.
Okay. While we're doing this, we're going to go ahead and note the respiratory rate. All right, now I'm going to check for kidney tenderness using the angular long word. Ready? Tell me if this hurts. No? Nope?
No.
Okay, good deal. Okay. While you're sitting here, we'll go ahead and assess the spine. Make sure that it is symmetrical, even. Good lateral sitting posture. Really good. Okay, looks good. You can sit back. Okay. We didn't note any lesions or skin abrasions, no redness, no swelling, no heat of any kind. Everything looks normal. Now, we're going to go ahead and check for skin tuger to make sure that she is well hydrated. We do that here at the sternum. Try to give you a little pinch, let go. Perfect, no tinting, go straight back to normal. Okay. Just run through my head real quick before we go any farther. I need to check her jaw for mandibular joint hinge and make sure it clicks well. So go ahead and clamp down tight for me. Now release, clamp and release. No clicking that I can tell. We also need to check for the touch and smell of the cranial nerves here. So go ahead and close your eyes and clamp your jaw tight for me, as much as it doesn't hurt. And tell me which side of your face you feel a touch. Okay.
Right. Left.
Okay. Everything seems to be in order. Now, I don't have anything for her to smell. This is the part where I would waft something under your nose. You would identify the smell of it, say it's sweet.
Okay.
Okay, so her olfactory nerve is intact. Looks good.
Smoke love.
Yep, it smells like latex, or this isn't latex. Anyways,
Fake text.
fake tex. Okay. I still can't think of what the gland in her throat is called. That is what we're assessing to make sure that it's not swollen, that everything seems normal with it, and it moves up and down as it should when she swallows, and it does. Okay. Now, we get chest pain, none of that, no surgeries, no injuries. Check your skin tuger. Okay. We're going to move on to the abdomen to go ahead and assess it. Okay. So first thing we're going to do is just look at it, inspect it, make sure that it is symmetrical. There's no abrasions, no lesions, no wound leakage. Everything looks normal. I don't see anything wrong with it. And then, yeah, it's symmetrical. So we're going to go ahead and auscultate it. And we start in the right lower quadrant. We're going to move to the right upper quadrant. over to the left upper quadrant and then back down to the left lower quadrant in a clockwise fashion. 1 minute on each section. Okay. Do a minute on each section. We note her vowel sounds as normal or active. Okay, now I need to ask you, have you had any noticeable differences in vowel movements, color, amount, texture?
No.
Okay. When was your last vowel movement?
Earlier today.
Okay. Everything seems normal. No stomach cramps, no pain in the gut?
No.
Okay. Alright, now that we've auscultated it and I've asked her for her bowel movement history, we're going to palpate it and make sure that everything feels normal and we don't feel any masses or any tenderness anywhere in the bowels. So we will just work our way around here. Any tenderness?
No.
No? No masses that I can feel. Everything feels soft, not overly tense. No tenderness for her, and no lesions noticed. No temperature. You can check the temperature of it in the back of our hand and make sure there's no fever or swelling to it. Okay. Sorry, I dropped my pen light in my pocket. Okay, so that's our bowel assessment. We're going to move on to the extremities here. So we'll start with your arms. Can you hold your hands up for me? Nails down. Okay. First thing we're going to do is check her capillary refill. Instantaneous, less than 1 second. The same for both hands. Go ahead and squeeze my fingers as hard as you can. Okay, even grip strength, strong in both hands. No trouble holding anything. You'll feel any weakness or pain in any of your joints. Okay, so I'm going to hold it up. I'm going to palpate it with the back of my hand to see if there's any fever to it. It looks normal. She is the normal color for her ethnicity. No edema. That's part of it.
Sorry.
You're very white.
Yeah.
There's no edema, no swelling, no redness, no lesions, no pain anywhere. Okay. Make sure that I'm not forgetting anything with the fingers or the hands. I think that's all for now. Okay. Then we're going, nope, I need to do the radial pulse on both arms. So give me your hands. Up. Okay, palms up. Thank you. They're both normal bilaterally. Her pulse is a 2-inch strength. Everything seems normal. Let's see here. Sorry, it's a slow. I'm just.
It's a lot.
It's a lot. Okay. Now, before we move on to the arms, when we're doing the chest expansion and listening for everything in the thorax, I would ask you: have you had normal breast examinations in the past?
Yes.
Okay. When? How often do you have a mammogram?
Every year.
Okay. Good deal. Okay. And if they don't, I'd educate them on the importance of that. And so, now we will move on to the lower extremities. And so, cross your feet for me. Okay. I would check the color of the skin, make sure that it is unilateral or bilaterally even. It looks good. It's the same everywhere. No redness, no discolored patches. Feel it with the back of your hands for fever anywhere. I don't see any. No signs of edema anywhere. Have you had any pain in your legs or knees, ankles, feet? No. Okay. Everything seems to be normal. I'm going to check her dorsal pedis pulse, which is really hard to find, but we'll just check the pulse on the top of your feet. they're both even. I would say there are 2, so everything's normal there. Now we're going to check the dorsalis, or sorry, the posterior tibial, and check the pulse there. Everything's normal. We move up to the popliteal pulses, make sure that they're all even. Okay, now they're all normal. So go ahead and pull your feet back against my hands. Okay, now push. Okay, now inspect between the toes to make sure there's no lesions, no cracking, no open spots. No redness, no fever anywhere on the feet, no sores. Check capillary refill on both toes, less than 1 second. Bilaterally even. Trying to run back through everything in my head, see if there's anything we missed. Okay. I think we're good. Can you get up? Can you stand and bear weight?
Yes.
Okay, so we're going to have you stand up after we lower the bed to a height where she can stand up. Lower the bed rails. Okay, go ahead. We're going to do range of motion. So we're going to start the head and work our way down.
Okay.
I think we have enough space. Okay, so with your head, go ahead and look to your left all the way. Look to your right. Look straight up as far as you can. Okay, and straight down. Now we're going to go in a circular motion, like this, all the way around. Any pain? Tell me if there's any pain at any time.
No.
Okay. So your head range of motion is good. Now we're going to go to the arms. Go ahead and hold your arms, palms up. We're going to bend at the elbows, straighten back out. Okay, go all the way above your head. All right, all the way back down. Now behind you as far as you can. Okay. Go back 2. We're going to go up and out. Back down. Now we're going to go in a rowing motion.
I'm backwards.
Okay, you're okay. Now just twist your arms or your shoulders. Okay. Looks good. Okay. Now we're going to do the same thing with the legs. We're going to bend at the knee. Bend to the other knee. All right. Go ahead and stick your leg out. Go all the way back behind you. Okay. Stick your leg out. All the way back behind you. Okay. All right. To the side. Okay. To the side. Now we're going to range around in a circular motion. Okay. Same thing on this side. Okay. Now, I need you to walk on your tiptoes towards me. Okay. Now can you go backwards on your heels?
My heels.
Yep. Okay. Good enough? Okay. Before I forget, let's do our range of motion of our ankle. You need to distance some of it.
Okay.
Foot out. Inversion towards yourself. Out toward your side. Okay. Inversion toward yourself. Out toward your side. You already pointed down with your tiptoes, so that's good. Okay. Arms, legs, head. That's about it. Okay, let's help you back into bed to get into a comfortable seated position. Okay, you can lay back. This is the part where I will inspect external genitalia, make sure that there's no lesions, nothing out of whack with color, swelling, fever, any kind of discharge we should be on the lookout for. Have you had any pain when you urinate? Any change in color or frequency? Nothing. Nothing to report. And then we ask about hemorrhoids and anal fissures. Have you had any issues with that?
No.
Okay. Everything's normal. Okay. And then, sorry, I'm trying to think if everything's good. I would get all of your supplies that you need, your cell phone, your TV remote, your call light, raise the bed rails, lower the bed to a safe position, make sure you're comfortable. Do you have any questions of me?
No.
Okay, and then I will get ready to leave. I will discard all my used utensils and gloves, perform hand hygiene, and leave. Now, I'm gonna go ahead and grab my paperwork for a minute to see if there's anything I missed. And the watch starts now. Okay, that's enough. Nothing that I can see that we missed. I will read it in depth more to make sure after this, but so far, so good. Thank you, honey.
Thank you.